Dr. Poli early on described me as a stroke waiting to happen.
Her cholesterol and blood pressure were sky high, and that wasn't even the worst of it. Coming up on today's All Things Heart, how this Kansas City woman turned her health around with her doctors by her side.
From the University of Kansas Health System.
I am amazed. The team here is great.
I came on a Tuesday, and then by Saturday I had a heart in me.
I have never seen a group of people work together so good as this team of heart specialists. I mean, it's just unreal.
Stand by to set up show.
And the Dolph C. Simons Jr. Family Broadcast Studio.
Roll it.
Always makes you feel like you're the most important patient on the planet.
I felt heard, and that was really big.
This is All Things Heart.
Good morning. It's Thursday, December 15th. I'm Alexis Del Cid, and welcome back to All Things Heart. Here's what we're talking about today. It's a common misconception that high blood pressure rarely affects women, but it can and it does. So today we look at the 3 things that raise your risk and the added dangers to your heart. Plus,
I've been going to her for 15 years, so she knows everything about our family.
we also talk about the importance of your primary care physician and how crucial teamwork is to your heart. And we love your questions. Your questions are the heartbeat of every episode, so be sure to send them in to us on YouTube, Facebook, and All Things Heart email. You'll find all of those links right here on your screen. The American Heart Association says nearly half of all adults with high blood pressure are women. High blood pressure makes your heart work even harder, and if left untreated, it can damage your arteries, leading to a heart attack, stroke, even heart failure. Ellen Ryan refused to be another statistic. She drastically changed her life for her health.
I feel younger.
Talking about life and sitting with Ellen Ryan on her back porch in Fairway is so easy and comfortable. She exudes a quiet peacefulness.
Do you think that I would have felt that from you had I met you 15 years ago?
No, never.
If you want to see any pictures of what her old life or the old Ellen was like as a high-powered litigation attorney,
It's long hours and it's stressful.
you're going to have to use your imagination. She doesn't have any. For decades, Ellen was too busy for that kind of thing or really anything else.
So your whole life has been really busy, jam-packed.
Yeah. I had trouble slowing down.
Life had consistently moved at a breakneck pace. Juggling everything from raising her 4 children to working 18-hour days, it was go, go, go. Most meals, high fat, high salt, highly processed, and eaten on the run. And exercise? Who had time for that? She gradually put on about 30 pounds, but not enough to see a doctor about it. The wake-up call came during her routine visit to her OBGYN, who told Ellen her labs did not look good and she needed to start seeing a primary care physician. What that doctor told her stopped her in her tracks.
Dr. Poli early on described me as a stroke waiting to happen.
Her cholesterol was over 300. Her blood pressure was sky high. Both her carotid arteries were blocked, and she wasn't about to wait around for that stroke. Instead, Ellen took charge.
Dwight Eisenhower was a Kansan, and he has a quote that says, "Plans are worthless and planning is invaluable."
We are so happy to have Ellen Ryan with us today, along with her internal medicine physician here at the University of Kansas Health System, Dr. Rebecca Opole, and cardiologist, Dr. Shannon Hoos-Thompson. Thank you both for being here. I want to get right to Ellen. Ellen, how's your blood pressure and how's your cholesterol right now? You look fantastic.
Well, they're both great. Yeah, thankfully.
You really took the reins when it comes to planning and just taking action. You drastically changed your lifestyle. Can you tell us about the changes that you made?
Well, I had to make a number of changes. I had to change diet and make sure that I was eating healthy instead of, when I was working, oftentimes I was eating on the run and eating highly processed foods. I needed to make sure that I integrated exercise into my day every single day. I started just with walking, actually, and with, which is now kind of old-fashioned. I started with a Fitbit and just worked my way into making sure that I got the 10,000 steps a day. And then I gradually moved into doing more stretching and strength training and meditation. So I did yoga and Pilates and still do that and meditation every day.
You also retired, correct? Was this the impetus for you to retire?
Well, it wasn't the impetus for me to retire, but I was ready to retire, and I think also, I think you're making a good point. As I slowed down, I realized that it felt good to slow down, and I was ready to retire.
I want to go to Dr. Opole now, because you told Ellen you're a stroke waiting to happen, which is so scary to hear. Was Ellen a rare case? Or do you see a lot of women who were like Ellen?
I see a lot of people, especially people who haven't been to the doctor for a long time. The thing about high blood pressure, high cholesterol, which are the risk factors for heart disease, is that they're asymptomatic. They're, so you're not aware that that's happening unless you go to the doctor.
So why is? Oh, go on. Sorry.
Yeah, some people are too busy with their careers, raising children and all that.
Yeah.
And they feel fine. So why go to the doctor?
And you sometimes start to think fine is just status quo, but maybe status quo isn't fine. Like you're so used to working. Ellen was working 18-hour days, running around, eating fast food. Did she even really know what fine was? Because she was so used to maybe feeling crummy.
She probably didn't know what fine was.
Yeah.
I think she was just, you're a mom, you have to work, so you just go, go, go.
Dr. Hoos-Thompson, why is high blood pressure such an incredible risk to your heart? What's happening there?
So if you think about even extra 10 millimeters of pressure, your heart beats over 100,000 times a day. So if you get an extra, your blood pressure's 130 versus 120, 140 versus 120 on that top number, 90 versus 75 on that bottom number, that extra force is happening every time your heart beats. And so if you're going 100,000 times a day, close to 1 million times per week, over time, that has an impact. And you hit something enough times hard enough, bad things happen.
Right, and Ellen was dangerously close to something bad happening. Real quick, we want to make sure when you're watching, you know the risk that you have of heart issues. So we have a QR code on your screen right now. Scan that QR code. It will take you to the health system's heart health assessment. It's quick, it's easy. Take that heart health assessment. Dr. Opole, I want to go back to you, because one thing I know from now knowing you for about a year now is you're so personally invested in each of your patients. So were you afraid when you saw what was happening to Ellen? Were you afraid for her?
I was very afraid, because as she said, her cholesterol was significantly elevated. Blood pressure was not quite, under control. She was in a very, stressful job. And so, in actual fact, and she actually had symptoms of an impending heart attack. Because when she came to me, she had started making lifestyle changes. She started exercising, but she had chest pain every time she exercised, and so she didn't want to exercise anymore. And she was also short of breath. So as soon as I got that information, got her labs, I referred her to cardiology immediately.
Did you think? I think you've told me you thought she was having a heart attack.
I really thought she was, yes, because of the symptoms.
Ellen, did you know this, or were you? How do you explain that to a patient without freaking them out?
Well,
right?
One is don't.
How do you do that? I mean, Ellen, what did she, like? How do you remember it? She said,
Am I allowed to say? I don't know.
I like that.
I remember that she was delivering some kind of bad news to me in a very calm voice, and I sort of ignored it for a little while, and then took some time to let it sink in, and then decided, I needed to take care of it. So I did.
And that's a really good point that Dr. Hoos-Thompson, you've got to hold back a little bit, but still get your point across when you can't say, I'm afraid for you. That would frighten me if my doctor said that. So how do you temper that?
I'm concerned.
Yeah.
That this, You
just say, I'm concerned.
Yeah, I just say I'm concerned.
No,
yes.
It's about what it represents. The cholesterol by itself doesn't give you a heart attack. The high blood pressure, diabetes, being a smoker, those things don't give you a heart attack, but it's what they represent about what's going on in your body.
Right.
And what it's setting yourself up for. And again, you set yourself up for these things, and so if you set yourself up for them, that means you can also reset yourself.
Right.
As our wonderful patient did, to accomplish better things with your investment in yourself, with some guidance from the doctors and the people around you, is kind of what are your priorities, and again, where can you refocus yourself. And ironically, as we get into a reflective time of year and we're looking for new beginnings in 2023, it's a great time to know that you have to invest in yourself before we can really help. And if we can help bring you to that awareness, either by smacking you in the face with, hey, you're in trouble, versus, you know what, here's your opportunity to move in a different direction, take care of yourself. And that's, I think that's part of the messaging I try to deliver in various ways.
And that comes down to the teamwork, is that I've talked to you both about how cardiologists work very closely with general practitioners and internal medicine physicians like Dr. Opole. So why is it so important, and I'll start with Dr. Opole on this one, to have that collaboration between you and various other specialties?
So, we are the ones who initially see the patients, take all the history, and all that. And if I'm concerned that somebody might have clogged arteries, for example, if it's not critical, I'll do that initial workup. I'll send them for a stress test. If it doesn't look bad, then we'll just do risk factor management, which is control your blood pressure and your cholesterol, because what ends up causing the heart attack and the stroke is after somebody if these things are uncontrolled for a long time. So if we catch it early, we can intervene and they never ever have to see a cardiologist. But if they come late, when they're already having chest pain, it's important for me to have that collaboration with cardiology.
Right.
I'll call them and I'll tell them, hey, this patient hasn't been in to see a physician for 10 years, the cholesterol is very high, blood pressure is very high, they're having chest pain, you need to see them before the end of the week.
And thank God that you have that communication, because you get those kinds of patients, Dr. Hoos-Thompson.
Yeah, and I think really it's one thing to hear what we say or do what we say to do, but the other thing is just to see us be able to do that. Nobody's in this alone.
Right.
And so to say to a patient, hey, you have to do this, like, yeah, they do have to take ownership in their lives, but hey, we're engaged in this with you, and we have other people around. Like, how do we engage with each other? At what point do you ask for help? Or say, how do I interpret this, or where do I go next? Or you say, yeah, it's time to come to me, and that can be a phone call versus flat out make the appointment or schedule the test. And then once those results come back, what do you do with them? Because it's not always black and white. It's not black and white. But as far as being able to work through it with somebody, because it can be messy, but you get to choose an adventure, and actually it can be a very productive one and gratifying situation. Somebody who recognizes what their life really means to them, and being able to make those commitments. And it's kind of like a light switch. When you see somebody actually make those changes and those commitments and have them come back and see that light switch got hit.
Yeah.
I mean, that's the moments in your career, in your profession as a physician, that you're like, okay, we're in a good place. And yeah, there's things that we can do to get them off the edge, so to speak, and keep them from tipping over in a bad way. But again, it's an engagement, and it's a relationship, and that's really a vital part of medicine.
Ellen, it must feel pretty good just to wake up in the morning. Can you talk about how you feel waking up and getting out of bed now on a typical day compared to how you might have felt 10 years ago or before you made these changes to get your health back on track?
Well, that's an interesting question. I feel I don't feel so rushed all the time. When I was trying to balance way too many things, I just felt rushed. And I always, like a lot of parents, I think, who are working parents, what we do is we make a list of the day of everything we have to do, but we're not on that list. And basically, in order for me to take care of my family, I needed to learn to put myself on the list, up at the top of the list every day, and make sure that I was getting some things done, like walking and eating correctly. And then at the next day, I could look back, and if I didn't get that done, I could have a little bit of evaluation of why that didn't happen, and then start over again. A lot of this is habit formation, I think.
I love the visual of putting yourself at the top of the list. You have a to-do list every day, And I would say rarely, probably, does anyone put themselves at the top of that list. You got all, right from the moment you wake up and grab your phone and check your emails, you're not putting yourself first. That's a really good visual. Dr. Hoos-Thompson, when it comes to heart disease risks, are they more noticeable after menopause?
Well, I'd say one thing, menopause is a late midlife event, and we know one of the uncontrollable things about heart disease is age. And so when you reach a certain age, you start to see changes in your body, and menopause accelerates some of those things. And I think in women, it's still not a fully understood mechanism, but we definitely see more issues with heart disease in women after they go through menopause, but there's several factors that drive that.
When it comes to treating Ellen, when you and I first talked about Ellen, and you had Ellen's permission to put me in contact with her, one of the things that both Ellen and Dr. Opole said was how you'd had this relationship for almost 20 years now, 15, 16, 17
About 15 years.
And you said, I'm not just her doctor, I'm the family's doctor. Like you see the whole big picture. How important is that? Because I know it was very important to Ellen, because Ellen had said when she went in, you would already know stressors that might be happening because you'd seen other people in the family. Can you talk a little bit more about that to our viewers, how you treat the whole family?
Yes. So when any physician sees a patient for the first time, you take the history, and part of that is the social history. I think until recently, we didn't really look at how we didn't think of social determinants of health, what impact they had on somebody's health. But if somebody, has a high-stress job, they're hypertensive, what is it that's happening in their lives that is making it impossible for them to take care of themselves? So it's important to know, what support systems they have around. If you make recommendations, for example, you need to exercise for 30 minutes every day. Number one, do they have the time? Mm-hmm. Secondly, do they have access to a gym? If you tell them to eat healthier, low-salt food, do they live in a food desert where all they get food desert? There are places where literally you have to get into a car to go and buy fresh fruits and vegetables. Mm-hmm. And if you don't have a car, much as a physician tells you to do those things, you cannot. So it's always very, very important to know what's going on in a patient's lives. And then we work with social workers, and we can assist with some of those resources.
So Ellen, you made a lot of those dietary changes and the exercise changes. You were able to retire and take that leap. For women who might be where you were 15 years ago, and they still are very limited on time, what do you say, what would be your best advice for them about how they could reduce stress? Do you have any, like a pro tip that you can share with us that any woman watching could do?
Well, yeah, I think Dr. Opole is making a very good point. I was very fortunate that I had access to good food and I can exercise, but I think I would go back to making a list every single day. When you get up, make your list, look at that list, and look for things that are going to bring balance into your life. If you look at balance as something you create as opposed to something you find in your life, then that means that you have to go on the list and be up at the top and make sure that you are getting your exercise, even the walking outside, even in the neighborhood. I realize that a lot of people don't even have that as an option, but it makes a big, big difference. That was a good place to start.
Just walking around your neighborhood. I want to go to some community questions because we're getting some really good questions from our viewers. Lisa has a question. Lisa wants to know, what are the common risk factors for heart disease? Just general risk factors. Dr. Hoos-Thompson?
Well, you've hit on the major ones. So simple things. We always talk about these really cool things we can do, but simple things. So your weight, your high blood pressure, your cholesterol, blood sugars, whether or not you smoke. I mean, if you talk about those 5 things, you're going to get the bulk of what, and be able to understand the bulk of what somebody's risk is. So that's where you always start. You do talk about things like family history and things like that, but I would tell you that it's really hard to lean too heavy on family history, because a lot of times if you haven't activated that family history by your own choices in how you eat, how you drink, how you exercise, whether or not you smoke, they're all tied together. So, and it's usually not just one thing that drives it. It usually is when you start to stack them up, is obviously when the real issues start to happen.
June has a question for Ellen and Dr. Opole. I'm going to ask Ellen first. What did you think your symptoms were? Like, what did you tell Dr. Opole when you went in?
Well, I knew that I was having, I was occasionally having some chest pain, and I knew that I was, that I felt I was really having a lot of trouble getting my weight off, and I knew that my blood pressure was high. That's what that got me started. I knew I was going to, and I knew my cholesterol numbers were not good.
And what were the things that Ellen said to you, Dr. Opole, that raised the first red flag where you thought, oh gosh, we need to take a moment and evaluate this?
So she came in and told me she had seen gynecology and she'd been told to come and see me immediately because...
Gynecology?
The first person she saw was a gynecologist who then said, oh, you know, did some labs and said, oh, you better go in and see your primary care physician because your cholesterol is terribly high and the blood pressure was not, you know, well controlled. But on top of that, she was having a little exertional chest pain. And so every time she exercised, she would have some chest pain. And, you know, that can be a symptom of an impeding heart attack.
Wow. John wants to know, this is a good question, are there symptoms if your carotid arteries are blocked? Would you have a symptom or feel it or anything, Dr. Hughes-Thompson?
No, you really
so how do
don't.
You know?
I mean, well, the brain's a very well vascularized organ. So that means if you have a slow, and most of the disease that we see is the slow narrowing, and the body's reacting to it, trying to stabilize it itself. I mean, it's not just letting something happen that shouldn't be happening or is potentially dangerous. The body is an amazing machine in that it recognizes that. So the answer is typically no. Even if you have a totally occluded 1, 2, I've seen people with 3 vessels and they're walking, talking completely fine. And so it all is about the timing of when that narrowing and ultimate blockage occurs in our body. Especially the brain is a very well vascularized organ, and so it can compensate for changes and reroute circulation to meet the demand.
Yeah, so whereas, you know, the carotids take blood to the brain, we also have blood vessels from the back of the neck, the vertebral arteries, taking blood to the brain. Exactly. So, and then, as she says, what the body does also, if the clogging goes on very slowly, the new channels, you know, will form.
Open up?
They'll open up.
Yeah, they react.
You still got these big clogs. Right there, it just sounds.
So typically a carotid artery does not close suddenly. They do not have thrombotic events, say like a coronary artery does. So the answer to the initial question is no. There aren't true symptoms until you usually have some sort of vascular event that suggests that there's a major problem there.
Vicki wants to know if you see more women or more men, Dr. Opole, that have the same problems as Alan.
It's about 50-50.
Okay, 50-50.
For my patients, if I just say off the top of my head, yeah.
Marie has a question. This is a really good question. Marie says, I have very low blood pressure, always have, and a long time ago a doctor told me to put more salt on things. It seems strange. Was that legit advice for low blood pressure? Who wants to take this one? Dr. Hughes-Thompson?
Oh, well, you talked me into it.
Should we salt more? If we're low?
You know, blood pressure is, again, it's you know, we talk about the numbers and range and things like that, but it's all relative. And so it's all about, are you symptomatic, are you meeting the demand? So the whole point of a blood pressure is to perfuse an organ or perfuse a tissue, perfuse a cell. And so a blood pressure of 80 over 50 completely fine based upon what your body mass is and what your metabolic demand is. If you are somebody that when your blood pressure runs low and you don't feel well and we can tell that things are not functioning appropriately, then something like salt or things that increase what salt does is increase the volume, which is going to increase the force. So that's one way to do it. It's not my preferred way if we don't have to. But the answer is you have to keep in mind that we're not just treating numbers. When we're talking about blood pressure, we have to put it in perspective. Again, why do you know the patient? Is because to know what that number means to that individual. And so it's
the whole person.
Yeah, and so my blood pressure being one thing, her blood pressure being another. Logan's in the booth. Hi, Logan.
Give Logan a shout out.
So men versus women versus age ranges, like recognizing what their blood pressure means at that person's level of life and where they are in life really is important. So it's just not just about the number. Those give us a good starting point, but they're not the ultimate determinant of how to intervene and when to intervene.
So when it comes to seeing your internal medicine physician, Jessie wants to know, are there specific tests that she can request when she goes to see her doctor and just say, if she sees the story about Ellen and says, wow, that was an eye-opener, Can someone come to you and ask for these 3 tests or this referral?
So what we do, we don't do diagnostic tests unless somebody has a symptom. We don't do a stress test unless you have a symptom, chest pain, maybe shortness of breath, and this is because these tests are not 100% sensitive or specific. If we did it inappropriately, we look at your pre-test probability of a heart attack, because if we do that stress test on just anybody walking in and it turns out abnormal, then the next step would be to do a very invasive test called cardiac catheterization. So the best thing for people to do is, follow up, let us treat your high blood pressure, your cholesterol. Let's modify those risk factors so that you don't end up with a heart attack.
Mm-hmm. That would be the ultimate goal. You don't want to end up there. Scott wants to know, this is a great question. Scott wrote in, should everybody check their blood pressure? Should everybody do it at home with one of those cuffs? Do we all know how to do that? Dr. Hoos-Thompson? Yeah, we know more and more that ambulatory blood pressure, which is what that is, checking your blood pressure at home or in a non-clinic setting, non-hospital setting, is a very vital thing, an important thing. Just always make sure it's resting, because your blood pressure, when you're stressed, when you've been exercising, even certain times of days, it's going to have a different range. But having an idea what your home blood pressure is, again, it's going to be in a range, and so chasing in individual numbers isn't necessarily the right thing to do. But yeah, but knowing your home blood pressure is a very reasonable thing. I have a question for Alan. Alan, what's a typical day like for you now? Because your olden days of working 18 hours a day sounds brutal. I'm sure it was exciting and you were very good at what you did, but what does a typical day look like now for you?
Well, it's very different. Now, I've always gotten up early, and so I get up early and I knit for a while. I kind of make my list for the day, what I'm going to do. As soon as it's daylight, I take a walk for about an hour. And then sometimes I do either yoga or Pilates after that. And then I oftentimes spend time with my grandkids and do cooking, that kind of thing. It's much slower. Lovely. And take art classes online.
That sounds lovely. And being in Ellen's house was joyful, seeing the pictures of you and your grandkids and your family. I want to bring all of our guests in for some final thoughts. And Ellen, I'll start with you. Do you have any final messages for other women who are watching right now, or men, or the doctors up here?
Well, I would say, it is doable to change your risk factors. And I would also say be patient with yourself, because it's a process and it takes, at least for me, it took me a long time to sort of retrain myself. But it is doable.
Right.
And worth it.
Perfect example of that. Dr. Opole, what about you?
I just want to say that I've learned something from Ms. Ryan today. Self-care and putting yourself first on the list. Mm-hmm. Parents don't put themselves first on the list because they're taking care of the family. But if you don't take care of yourself, how are you going to take care of the family? So put yourself first on the list, and part of that is, do some exercise, put some time aside for yourself, and definitely, please, please, please come for your annual physical once a year so that we can diagnose that hypertension, diabetes, we can do cancer screening, and intervene early. Mm-hmm. Yes. Thank you.
Dr. Hoos-Thompson?
Tough acts to follow. Yeah, tests don't change the outcomes. A lot of patients or people already know when they're in trouble or when they need to get checked out. Don't be afraid to let us know that you need help or you need some direction, and that's really what it's about. And that goes for us. Sometimes we learn a lot from our patients. It's not just us giving information, and a lot of times we see how they take care of themselves, like, hey, this is my opportunity to maybe go home and hug my kids or take them on a walk with me and help be the example. But yeah, the message is it's not about testing. It's great that we have all these tools and resources, but it really does come out to an individual's relationship with themselves and the relationship with the people around them, and where can we engage with those things is really where the deep and lasting impact is. And so I'm actually very grateful that this is a segment that you chose to do as a part of All Things Heart.
I feel like we're all going to be quoting Ellen about putting yourself first on the list. Thank you for that. I mean, I will quote you to my girlfriends when I talk to them. This has been great. Well, we're not done yet. We have another segment. We love this one. It's called Behind the Mask. It's where we are able to give you a sneak peek at what our healthcare workers are like on a more personal level. So let's get to know Dr. Opole better. Dr. Opole, you are always on the go, and you sent us some. Oh, this is Dr. Who's Thompson. We're going to start with her.
Yes.
Okay, time out. Well, there's Dr. Okay, where are we going? Dr. Who's Thompson?
Yes.
Okay, got it. Dr. Who's Thompson. This looks like the North Pole, but it's not. It's your front yard.
We're working on it.
This is great. Are you one of the neighborhood people who goes like all out and the people drive past your house on Christmas Eve?
I mean, it puts me in better spirits when you talk about things that you enjoy and finding those tidbits that make your day better. Yeah, so I like to get out and put up holiday decorations, and I'm going to add the gutter lights next year, I'm pretty sure. But I try to, I love decorating for the seasons and holidays, and this is this year's efforts.
You sent us some really nice pictures of your inside your house and some things that your mom did with you. So you guys are super crafty.
I am not crafty, but my mother takes the reins on that, and I love it. Let her go with it.
Is Christmas decorating like your Super Bowl?
Yes, fall is really a close one. Halloween and that time of year.
Do you do it for Halloween too?
Oh, Halloween's pretty much equal to this, at least.
Okay, well, we have to have you back in October.
Yeah. So, but I try to get all the seasons. Those two are the biggest and the best. And there's some of my mother's handiwork. She needs noses on a couple of those snowmen, but we're getting there.
I love that. Okay, Dr. Opole, now it's your moment. You sent us some really good pictures of you doing all sorts of things, traveling, bowling, enjoying lunch with friends and coworkers. So run us through who we're looking at. We just saw some of your family members. Who's that?
Oh, that's me bowling.
Oh my gosh, great.
What's your average?
And then out with workmates, we decided that this was, important. Self-care.
What's your average bowling? Dr. Who's Thompson's competitive. She wants to know.
Not good.
I could come with.
And that's me and my nieces and nephews.
And you're
I have
pretty
a few in
proud,
the city. Yeah.
Proud mom too.
That's my mom.
Yeah.
Yes.
Proud daughter.
She's turning 90 soon. Doesn't she look good?
Was that a recent picture of your mom at 90, 89?
And then I love traveling, hiking. That's my spend a lot of time. Any free time I have, really, I travel.
And I got to ask you about your daughter. She's a filmmaker, right?
Yes.
Or a budding filmmaker, an
She's
aspiring
a budding filmmaker in New York City. At the moment, she's working in advertising, but hopes to, make films one day.
So great.
Yes.
So
and
great.
That's me and my husband and my 2 children.
Aw,
yes.
Beautiful pictures. Well, thank you so much, Dr. Opole and Dr. Who's Thompson, for taking time out of your busy schedules to join us. We know you both have patients to see, so thank you for doing this. And thank you to Ellen for sharing your journey and your insight with us. It's so valuable. We will be sharing this in episodes to come and as we go on through our own lives, telling people to put themselves first on the list. A quick housekeeping note, we are going to be on hiatus the next few weeks after this, preparing for season 3 of All Things Heart. But you can still enjoy encore presentations at 10 a.m. every Thursday right here. Have a great rest of the week, and thank you so much for watching.
We want to let you know that starting next week, we will be taking a couple of weeks off from our program so that we can spend some time with our families.
The good news is you'll still be able to watch our morning medical update every weekday and All Things Heart on Thursdays.
That's right. We have chosen some of our very favorite episodes from the last year as encores, and we've recorded some pretty fun introductions to help remind you what each of those episodes is about. Wait until you see how many ugly Christmas sweaters Dr. Stites and Dr. Hawkinson own. Very interesting.
I can't wait. And then we return with live programming on Wednesday, January 4th. Until then,
happy holidays.